Thank you, and good afternoon, and a warm welcome to everyone today on International Overdose Awareness Day 2024. Thank you to everyone joining us today on this live webinar. We appreciate your participation in this very important conversation and this very important event. As a reminder, this webinar is being recorded and will be made available on drugs.ie for those who wish to revisit or share it afterwards. International Overdose Awareness Day is the world's largest annual campaign to end overdose, remember without stigma those who have died from overdose, and acknowledge the grief of the family and the friends left behind. It is a day dedicated for time to remember, time to act. In Ireland, the need for this awareness is underscored by the latest figures from the Health Research Board, which show that there were 409 drug poisonings in 2020 alone. These are not just statistics. These are lives lost, people with families, friends, and communities left behind. Every one of these deaths was preventable. Each number represents a person, a life cut short, and a devastating impact on loved ones and communities. The sub-theme for this year is Together We Can resonate powerfully in our Irish context, highlighting the strength of our communities when we unite to address the challenges of overdose and overdose prevention. Whether it is raising awareness, advocating for policy changes, or providing direct support to those at risk, we can make a difference together. Overdose affects people and communities in many ways, and today provides us with an important opportunity to raise awareness about drug overdose and the related issues with the aim of reducing the stigma associated with drug-related death, acknowledge the grief experienced by families and communities when they lose a loved one to overdose, and ways we can support to reduce overdose. Throughout today's session, we will hear from 6 insightful presenters who will speak to how together we can reduce fatal overdoses by supporting those who use drugs. We'll learn about the life-saving potential of naloxone, the progress of the CIRCLE program, and the significant findings from the non-fatal overdose NEIC project. These partnerships are crucial in raising awareness of overdose signs and how we can respond effectively. We'll learn about the development of individual overdose safety and rescue plans, the link for which will be shared in the chat later and in the post-webinar email. I would like to extend my gratitude to all our presenters for their invaluable contributions to this discussion. I also would like to thank IMS for facilitating this event and express our appreciation to the community first responder volunteers who are supporting the demonstration events taking place tomorrow, which we'll hear more about later. In addition, I'd like to thank all other organizations who today are acknowledging International Overdose Awareness Day. Let us use today as an opportunity to recommit ourselves to action and support. Together, we can make a difference in preventing overdose deaths and building a future where no one is lost to overdose. So on that note, I'd like to invite Minister Burke, Minister of State with responsibility for public health, well-being and national drug strategy, to provide the opening address. Minister Burke.
Good afternoon, everyone. I'd like to extend a very warm welcome to this very special event to mark International Overdose Awareness Day. I want to thank the HSE National Social Inclusion Office for organising this commemoration, which is part of the annual worldwide campaign to raise awareness about overdose deaths. To all the families, friends and communities, we acknowledge your loss and grief. We also recognise all of our colleagues who work in treatment services, emergency services and hospitals across the country. They are often the ones who respond to overdoses and work hard to save the lives of the people they support. We acknowledge your loss too. According to our most recent figures, which is 2020, there were 409 overdose deaths in Ireland. 155 of them were women, 58 of them were homeless, and 174 died alone. Most of those men and women were under the age of 45, representing lives which were tragically cut short. All of them will be missed by their loved ones, their families, and their friends. These tragic deaths could have been prevented. As a society, we must do more to reduce the risk of drug overdoses. The theme for International Overdose Awareness Day 2024 is Together We Can. This recognises the strength of the support we can give to those who have lost a loved one through overdose. As we are all aware, the drug market is changing. Synthetic substances are creating new dangers for people who use drugs, including higher than expected potencies. The recent nitazene overdoses that were widely reported in the media is one example of these new threats. As part of its response, the Red Alert Group raised awareness of the danger of nitazenes through many channels. It issued advice to first responders, hospital medical teams, and services to reduce the harm. This really helped to avoid deaths and minimize overdoses. The response by services demonstrated the power of what can be achieved when everyone works together. This is an international challenge, and governments need to work together to share information, identify the threats, and respond to these developments. An example of this collaborative approach is the work of the British Irish Council Public Health Responses to Synthetic Opioids. Yesterday, Ireland chaired a British Irish Council workshop on synthetic opioids to review the public health response to synthetic opioids across the 8 British Irish Council administrations. Drug overdoses require good health responses, such as safer injecting facilities, more treatment services, greater access to naloxone, and better awareness about the risks and consequences of drug use. Getting more people with problematic drug use into treatment is a key step in reducing the risk of drug overdose. It is very encouraging to see that the additional investment under the National Drug Strategy over the past few years is expanding access to and availability of treatment for those who are seeking help with addiction issues. This government is committed to a health response to drug use, so we have prioritised targeted investment to ensure services are available to those who need them. In an effort to assist people to access services, the Department of Health and the Health Research Board recently published an interactive map of publicly funded drug treatment and drug-related family support services. This online map features over 440 publicly funded services. This online map features including services provided directly by the HSE or community-based organisations and residential services. It will help individuals to navigate and access the wide range of services that are now available for problematic drug and alcohol use. In July, I announced over €830,000 in funding to drug services for women with complex needs to reduce drug-related harms and premature deaths among this group. Data from the National Drug-Related Deaths Index showed that women account for 38% of drug-related deaths. This project aims to meet the needs of women who are at risk of drug-related death and is being provided for under the Women's Health Action Plan to improve access to healthcare services for marginalised women. I'm confident this initiative will develop integrated care pathways for high-risk drug users to achieve better health outcomes, a strategic priority under the National Drug Strategy. In relation to the supervised injecting facility, my department and the HSE have been working with Merchants Key Ireland to get the service up and running by the end of 2024. It will provide a safe place for clients with supervision by specially trained doctors and nurses. People using this service will have an opportunity to connect with health services and perhaps start their journey to recovery. My department is also working with the Dublin Simon community to open the new 100-bed health and addiction care facility for people who are homeless. The Department of Health also continues to work closely with the HSE National Naloxone Oversight Quality Assurance Group to highlight the benefits of naloxone and also to make naloxone more widely available. This life-saving medication is so important in reducing deaths from overdose. Making naloxone more accessible to services, families, emergency services, and on Garda Síochána is really vital if we are to save more people. Colleagues from the HSE here today will provide more detail, but I just want to acknowledge their work and assure them of my continued support. To reduce harm and prevent overdose, we need to encourage people to get medical help if they feel unwell or suicidal after using drugs, and not to hesitate or delay as a result of stigma and fear. Doctors won't judge you, they want to help. It is also important that services are available locally when needed. I'll come back again to the themes of today's event. Together we can. It is very important that we all work together to improve health and social outcomes for people who experience harm from drug use and meet their recovery and rehabilitation needs. I want to thank all of the people here who volunteered to contribute today: Professor Eamon Keenan, the Jenny Smith, Donna McGee from the HSE Addiction Services, Dawn Russell, Director of Services and Alifi Drug Project, Professor Johanna Ivers from Trinity, Andy O'Hara from Ishka, Stephen O'Flaherty, Community National Ambulance Service. Finally, I would like to thank you all for attending this day of commemoration and to extend my deepest sympathies to all of you affected by drug-related deaths and overdose. Thank you.
Thank you, Minister Burke, and thank you for your support today and for your ongoing support for awareness and prevention of overdose. And that I'd like to introduce Professor Eamon Keenan, the National Clinical Lead for Addiction Services, HSE Social Inclusion Office. And Eamon today is going to share with us an update on the naloxone programme in Ireland. Thank you, Eamon.
Thank you, Dennis. And good afternoon, everybody. I'd also like to thank the Minister for his ongoing support for us and for his advocacy for us at the Cabinet table to ensure that with each budget we continue to get funding for this really important programme. So this day is a really important day for us in the HSE and the National Social Inclusion Office because it allows us to take a pause to remember those people who have lost their lives through drug overdose and also to acknowledge them the grief of their families and friends. Today, I'm going to just give a fairly short presentation in relation to our naloxone programme, some updates and highlight some of the important developments that have occurred within the last year. In terms of the naloxone provision, year on year, we can see that we've had an increase in the number of units of naloxone that we've provided. So even in the first 7 months of this year, we provided over 4,000 units of naloxone. One of the trends, just to note here, is the increase or the sort of shift from the injectable naloxone, the peroxide, to the nasal, the Nixoid. And I suppose that since COVID, we've seen this type of naloxone being more widely used. So that's encouraging, and it shows us that we're getting the units out there to people who need them. In terms of administrations, then we have our data from 2023, which shows that there were 461 administrations of naloxone over the course of that year. In terms of location, 65% of the incidents were in Dublin. 80% of the individuals who received naloxone were male. And just one other thing to highlight there is that 45% of people who received naloxone then went to hospital with the National Ambulance Service or Dublin Fire Brigade. If we look at our 2024 figures, we see a slight up to date. We've seen 242 incidents. We've seen a slight reduction in the Dublin incidents. One of the things to note then, a couple of things to note then, is that in 2024, 30% of the incidents have involved women compared to 20% in 2023. And also more people went to hospital with the National Ambulance Service, Dublin Fire Brigade. And that's perhaps an indication of the impact that the synthetic opioids have had. Another really important part of our work has been naloxone training. And this year, there's been a significant development in that regard. Last year, we trained over 2,000 people in naloxone administration. But in 2024, in January, we launched our opioid overdose awareness and naloxone administration training course on HSE land. So that's the HSE's online learning and development portal. And to date, really, we've had over 1,500 people have completed Module 1, and 381 people have completed Module 2 on HSE land. This is really, really important because this successful completion of both modules allows services to obtain opioid overdose awareness administration certificates, which allows for HPRA registration for services. We've also worked on our other training with our partner services to provide training to people who are supported in the community. This is sort of in-person training, and in the first 7 months of this year, we trained over 1,000 people in person, and that includes 670 peers. As part of that training, the peers were provided with naloxone. In June of this year, another important development was that the Pharmaceutical Society of Ireland approved Module 1 as a critical part of the training requirement for pharmacists. And this allows pharmacists then to supply and administer these life-saving medicines. I mentioned the training that's been developed for HSE land. We started in January of this year. And since then, 11 separate services have registered with the HPRA. And this is really important because this allows them to procure naloxone without the requirement of a prescription, and then to hold the naloxone on site for staff to administer in medical emergencies. This is a real game changer in terms of the availability of naloxone for services. Another important development that we've seen this year, and you're going to hear a little bit about that from Donna in CHO1, has been the Circle program. So this is a collaboration between the HSE and partner support services, which we launched in 16 locations across the country. This looks at peer skills and education, supporting those people who use drugs to understand the overdose risks and to take steps to prevent overdose. But also, if they're around someone who is overdosing, to intervene effectively. To date, 12 of those programs have been completed, and 71 peers have now been trained. Another part that you'll be hearing about today are the overdose and safety rescue plans. So we know that in 2020, 42% of those people who died of an overdose died alone. But naloxone is only effective if there's somebody there to administer it. So as part of today's event, we're launching the development of individual overdose safety and rescue plans in Ireland. And you'll be hearing that from Dawn and Dennis Manolitvi. This is following the UK example. And I'd like to particularly acknowledge the work of staff and peers in Analifi Drug Project and ISCA, who have been supporting us in the drafting of this plan. The Minister mentioned the supervised injecting facility, the medically supervised injecting facility. So this has been a long time in gestation. I think that gestation here is counted in years rather than months. And we know that a medically supervised injecting facility is a safe, medically supervised healthcare environment where people can inject drugs under the supervision of trained health professionals. It's aimed to provide person-centered care, reducing the harms associated with drug injecting, and then, I suppose, really attracting and working with those people who are most vulnerable and marginalized in our society. It also aims to reduce public health risks such as needle sharing and to reduce needle litter on the streets, or drug injecting litter on the streets. At this point, we plan to open in December 2024, and the refurbishments are well underway in Merchants Quay Riverbank facility. So we're fully committed to working with Merchants Quay to improve the harm reduction services, specifically for people who inject drugs. And this will have a knock-on effect of reducing drug overdose. This couldn't have happened without the engagement of a significant amount of stakeholders, all of which are represented here. So we've had Merchants Quay and Guard, Ishkona Ambulance Services, Dublin Fire Brigade, ISCA, the Department of Health, task forces, local community and sports, and the Dublin Regional Homeless Executive. The meetings are being hosted by Dublin City Council, who have been very supportive of our initiative in this regard. So that's really, I wanted to just give that brief overview in relation to the updates, the developments that are happening. And I'd also like to thank specifically Jenny Smith for her work over the last year with us. As people who know, she's really committed to this program, and I don't think we'd be in the robust place that we are today without her input and support. So I'm going to stop sharing now. Thank you.
Thank you, Professor Keenan, for that insights into the work that's being carried out for the past year. A lot has been done and there's still more to do. And I completely concur with the statement that without Jenny, this program wouldn't be where it is at this moment in time. So I'd like to acknowledge that as well. On that note, I would now like to introduce Donna McGee, HSC Addiction Services Lead for CHO1, who will be presenting on the HPRA registrations in the Circle programme. And Donna is joined today by James Devaney, who is the CE Scheme Supervisor and Circle Programme Facilitator. So thank you so much, Donna and James.
Thank you very much, Dr. O'Driscoll, and thank you to everyone for the opportunity to present here today. I suppose, as Professor Keenan has talked about the changes, and I suppose the progression in naloxone has been really, really important for us in CHO1, especially the online module 1, where anyone can go on HSE land and do it. There was kind of some people thought you needed to be a HSE employee to access HSE land, but that is not the case. Anyone can go on and register an account and complete the naloxone module 1 training. And I suppose the important thing for us was that we were, if you want to, Cormac, move to the next slide, we were able to get 3 trainers in the locality trained in our region in module 2. So in CHO1, we have a region of Donegal, Sligo, Leitrim, Cavan and Monaghan. So we were able to get 3 trainers, myself and 2 of the addiction managers in the area have trained in module 2 training, which means we do the practical training on how to administer naloxone. And we can, I suppose the benefit of that has been that people don't have to go to Dublin for that. That can be done locally, because there's a difficulty with people having to travel to Dublin in order to do that. And if people are finding it difficult or nervous, we can help them with that. That has been a huge thing. And I suppose the rollout of naloxone and the HPRA registration has been huge for us, because previously, in order to get naloxone, within our services, you'd be reliant on maybe if it was prescribed to a person and they had left it in the service, or you'd be using it. And then there was challenges with that because people were nervous about using somebody's prescription on somebody else, which I totally understand that. So the fact that it can be prescribed to a service has been an absolute game changer for us and has been really, really beneficial. And I suppose as well, with now naloxone being available in a nasal spray, that has alleviated a lot of the fear, whereas before people were quite nervous about to administer an injection. So that has alleviated a lot of the fear for us. It's been great. So we can move on to the next slide, Cormac. So I suppose we were very lucky to get 3 circle programs in CHO1, and because of the geographical spread, we were able to get 3. So Donegal, one area, Sligo and Cavan, where and all of them have finished, and the Cavan program are having their graduation next week. I suppose the feedback from participants has been really, really positive. A lot of the participants had said that they hadn't known CPR before. They didn't understand about the recovery position and the ability to be able to do an intervention that has the potential to save or will save somebody's life was received really, really positively. And because of geographically where we're based, in Donegal or Sligo or Cavan, if you call an ambulance, it's not like you're guaranteed to get an ambulance within 10 minutes. You could be waiting half an hour for an ambulance. And again, we do know that naloxone needs to be used, you know, if a person is alone, then it's not beneficial. So by being able to educate people on all this and do this with the training has been really, really beneficial. So I am going to pass over, Cormac, you can move to the next slide, because I'm going to pass over to my colleague, James Devaney, who is the CEC supervisor in Donegal, and James is also a facilitator on the Circle program and does great work. So we're delighted to have James here today to talk about the experience on the ground of delivering the Circle program and the benefits of it. So I'm going to hand over to James. Thank you very much.
Hello everyone, my name's James Devaney and I work for Letterkenny CDP in Donegal. About a year ago, myself and a colleague was approached to do the Circle training with Jenny in Dublin. And I suppose at the start we were a wee bit kind of, what's this about? But when we went to it, you know, we actually could see this was going to be a game changer for us in Donegal, for family members, for people using drugs, for everybody involved. This was going to be a game changer. For myself, I could see that, you know, for a long time there was like missing gaps in services, and there was people who sometimes we felt was falling between these gaps, but we've seen that the Circle training would reach a lot of these people. The Circle training would have equipped us with the knowledge and the skills to help other people to respond in the event of an overdose. Prior to that, like I would have worked in, my own background would have been addiction counselling, and I would have worked in Scotland, and I would have worked in rehabilitation in Donegal until I started working within the community now. And previous to that, I would have spent about maybe 16, 17 years in active addiction myself. I would have seen people taking overdoses. My thoughts today are with a good friend of mine who died in 2012 from an overdose. And I can see how programs like this do save lives. People like, you know, programs like this really do help on the ground. And as I say, those missing pieces, when we brought the program back to Letterkenny, just as we came back with the training, there was an epidemic of opioid use in Letterkenny. And there was a lot of people that was getting sucked into it because there was a shortage of other drugs, and they were turning to the opioids. And it was good because we were able to bring that training and bring that knowledge to families, to drug users, to people working in services as well. Myself, my colleague Karen would have rolled out the first program, and we identified 8 people, a good, you know, a wide range of people. There would have been some people who would have been users, some people would have been people in recovery. There was family members, and there was also people who would work as weekend supervisors or night supervisors in rehabilitation units or in secondary care houses. The feedback from the people that would have completed the training, I mean, like, they thought it was amazing. The educational piece seemed to be the most important part for them. spotting the early signs of an overdose, spotting when people would be in in a danger to an overdose, you know, like different times. It could be a day, maybe when access to their children's cancelled. It could be coming up to Christmas time when the double week is paid out maybe on their dole, you know, spotting wee times like that there. But also even just to have that conversation with somebody. Look, I'm worried about you. You know, I can see signs here. If we see maybe a family member who's maybe starting to buy drugs from a different source, they're starting to mix it with other drugs. So the educational piece was really, really important with them. Then when we went into starting to learn the CPR with them, like it really, really helped the families. We had one lady, her partner would have been a user for a good 6-7 years. Like, and you know, she spoke about the amount of times, as she called it, just all I could do was roll him over on his side. But when she was trained in how to do a lot more than just put somebody into the recovery position and was given the naloxone, like it really empowered her that she could make a difference in the event of an emergency. We had a mother as well who had really empowered. Having the educational piece was a huge help to her, knowing that in the event of something happening, I can actually do something. The people working in services would have said the same, that if something ever happens, we can do something here, you know. And it would have brought myself even back to my own time in active addiction, you know, the amount of times I would have seen people that we wouldn't even have recognized signs of an overdose. He's having a sleep in the corner, sure, he's snoring away. We wouldn't have recognized that snoring was actually somebody going into overdose. Looking back, I can see the amount of times I would have came through maybe overdoses myself, where I would have thought it was just a good night, but it was actually going into overdose, where I was lucky enough to come around, lucky enough to bring this program to the people and make a change, because I do like that wee thing. It does sound corny sometimes, but that together we can make a difference. And I do see how the naloxone training and the circle training has brought a huge difference to the people in Donegal, especially how it empowered people. It gives them that piece of education, but it also gives them the confidence that in an emergency or in an event where somebody has went into overdose, we have the skills, we have the knowledge, and we have the product, and we can do something about it. And together we can make a difference. You know, and it gives people hope then going into the future that we don't have to go through as much of this, that we can start bringing the figure 400, 409, we can start bringing that down, because that's where programs like this, I can see, will start making the difference on the ground. So with that, I'll just hand back over now. So yeah, lovely, thank you.
Thank you, Donna, for showing how important the changes to the training to allow organizations to become registered with the HPRA, and James, for clearly showing that how the Circle program has impacted in a real way on lives, and also at this time to acknowledge your grief. So on that note, I'd like to go and introduce Dawn Russell, Director of Services, the Anilify Drugs Project, who's presenting on the drafting process and the launch of the Overdose Rescue Plan. And who's joining Dawn today is Dennis Brovkin, who's an Anilify peer worker and Circle graduate. So thank you so much, Dawn and Dennis.
Thank you, everyone. Hello. I'm here, of course, struggling to share my screen, even though I practiced this a million times. Sorry, Dennis, letting us down before we even start. My name is Dawn, and I'm going to speak briefly and then hand over to my colleague beside me here. So we wanted to talk to you today about the rescue plan resources that the HSE are launching today for International Overdose Awareness Day. So these are really practical tools that will help staff, peers, loved ones talk to people who are at risk of overdose about, first of all, preventing an overdose, but also who can be their lifesaver if they are overdosing. So Jenny in the HSE did a lot of work to think up some templates of overdose rescue plans. Thank you for sharing, who's ever sorted my tech problems. So Jenny did a lot of work to get templates together and then kindly handed them over to Annalifia and asked us to work with some peers, people who would know what changes might need to be made to them. So myself and Dennis, who is one of our paid peer workers, as well as many other things, sat with 4 more colleagues, and we spent 90 minutes in a focus group looking at all the materials that the HSE had sent through, and the team brainstormed and gave a lot of feedback on the materials, and then they decided to take them out on the street. So Dennis will talk about this in more detail, but himself and his 4 other colleagues all chose different ways to spend a week working on these materials with other people who use drugs or people who are in recovery. So some of the guys took them out on outreach. Some of the guys took these resources back to their recovery houses, to their hostels, to their day programs and into the community, and spent a whole week working on these materials with people, engaged with them and took their feedback. So Dennis is going to share with us now what he learned and what his colleagues learned during that week. Okay.
Hello, everyone. My name is Dennis, and I'm a recovering addict. I'm linking with Annalifia for a few years now. I finished stabilization program with them, and most important, circle program, naloxone training. And after that, we were able to talk to people about overdoses prevention in our hostels, in our day program, in our C scheme, with family members, friends, mates, and others. And there is a most important point, as we think there is a language barrier. First of all, I think it was that many people don't understand English, and we recommended to translate posters and the rescue plan to different languages, and it was easier to talk to people in their own languages. Another point, we found that many people are afraid of naloxone naloxone needles, and many people don't know there is a nasal spray naloxone, and as was said before, most people prefer a spray one, naloxone. And when we were talking to people, we found that many people think they know everything about overdoses and naloxone, but when you show them the rescue plan and the facts, they realize they don't know it at all, and they were more open to learning and have conversation. This is why information and a rescue plan is so important, I think. And posters and rescue plan is it helps people to be aware of naloxone. Some people have heard something about naloxone but didn't know what it was. And when we're talking to people, we were able to explain them what it exactly is, how to use it right, and where to get it. Another thing, when we're talking to people, most of them think it will never happen to them or their friends, but when we show them the numbers and percentage, they were shocked really, and afraid, and possibly afraid. And after that, they were open to learning, to have a conversation and carrying naloxone with them. Thank you. Thanks.
Thank you, guys.
Thank you, Dawn and Dennis, for that. Dawn, particularly for how and organizations would start the development piece with the rescue plan, and most particularly to you, Dennis, because without your input into this, there would have been a lack of inclusivity, there would have been a lack of information to how this program should run with regards people who use drugs and vulnerable service users who weren't aware of how to access the product, who weren't aware that the nasal one was the preferred one. So all that information is so important for us, and peer-to-peer is so important, and without peers being involved, this program, in my opinion, would be at a significant disadvantage. So thank you very much, Dennis. On that note, I'd like to introduce Professor Johanna Hivers, Associate Professor in Addiction, Trinity College Dublin. And today, Johanna is going to be sharing scientific evidence about non-fatal overdose. So thank you so much, Johanna.
Thank you, Dennis. And just to say a big thank you to Dennis and Dawn, and also James and Donna, and also Professor Keenan. So as Dennis said, I want to give a brief overview of non-fatal overdose and the scientific evidence, because like most things in public health, it gives us an opportunity to intervene and spotlight the initiatives, interventions and programs that are doing well, but also the opportunities for growth in that space. So thanks for including me today. So very quickly, I'm just going to talk about the what, the how, the why and the who. Looking at, I suppose, landing on prevention and, as I say, evidence-based responses. So just very briefly to say, you know, and singing to an audience, I'm sure, but overdose occurs because a person's tolerance is out of whack with their the dose that they're taking. And as I say, these presenters with opportunities to then educate people around these things. So how do overdose occur? Well, it depends on the person, the underlying condition of that person, of course, and then the drugs that they are consuming. But globally, we can look at these in three categories: stimulants, depressants, and dissociatives. And again, depending on the I suppose, substance at play, that will act in a different way. And we know that in terms of, let's say, upper drugs or cocaine, methamphetamine, and Adderall, we know that, again, that this acts on the cardiac system. And again, when we're talking about things like opioids, we're looking at it depressing the respiratory system. And then dissociatives then, as I say, may cause a different effect, but I think it's worth saying. In terms of why does overdose occur? Very simply because of adulterants, reduced tolerance, and sometimes, unfortunately, as an intentional act. Sorry. So for some reason it's, yeah, apologies. But I suppose the big key message today, particularly, as I say, from a public health perspective, is non-fatal overdose is one of the biggest indicators of a fatal overdose. So again, acknowledging all of the deaths that have gone before us, and absolutely sincere condolences, but at the same time, it presents us with an opportunity. So when we talk about people having a non-fatal overdose, we should see that in the sense of being able to intervene. And I know that there is good work going on that I hope to spotlight, but also look for those key areas for development. So we've just completed a large systematic and meta-analysis looking at all of the international data that looks at non-fatal overdose, which is due to be released. We were hoping for this week, but in the next month. So again, you may know this, but age is a significant factor for people. So people who are younger are more likely to experience an overdose, both fatal and non-fatal. Gender plays a key part, as Eamon presented the figures both nationally, but equally internationally. We see that males are more likely than females to overdose, despite the fact that female numbers are growing. Again, drug types are, you know, opioids, benzodiazepines are at the highest risk of overdose. So again, if we look at that global picture from the UN drug report, we know that in excess of 600,000 deaths occur, and about a quarter of those then are related to opioids. So massive risks. But again, I'm a firm believer when we know what the population looks like, we can absolutely respond to their needs. So then I suppose in terms of co-occurring factors that drive that, we know that people who are more likely to be depressed, suicidal, and have a co-occurring mental illness are at higher risk. People who unfortunately discontinue OAT, I apologize, that should have said OAT there, are at high risk of overdose. So again, that's really important program that we have. And I suppose, again, just to add to that, then we know that other OAT methods, such as buprenorphine, are showing protective factors for people at initiation and early phases into OAT program. So again, lots of lessons to be had. People who have lower education and are experiencing homelessness are a higher risk of overdose. People, again, who are polysubstance users, and in particular alcohol becomes quite a dangerous drug to be consuming alongside other drugs. So I just want to give a very brief overview of the national data that came from Sean Miller's study in 2022, which looked at non-fatal overdose, looking at the HYPE, or the National Hospital data. And what we see is no surprise, is that from the last year, so he looked from 2010 to 2020, and what he found was overdoses were, going up exponentially, as you see there. So again, we then have built on this study. We're currently looking at this in North Inner City, but also broadly nationally. So building on the work that was done, we are now looking at that hospital data for the same years, but extending into 21, 22. And what we found was that, again, non-fatal overdoses, when we isolate them to inner city, and we're looking at this not just in the North Inner City, but also in South Inner City, so inner city hospitals, we see that methadone has, surpassed heroin as an overdose presentation. But I want to really crystallize the fact that this is a marginal increase. And again, in terms of that public health perspective, people who are, in receipt of methadone are on a program. And so there is a big opportunity for education and intervention there. As we move out broadly and we consider across the country, and we're looking at the same hospital data, you can see that other opioids, and that's how the hospital, the HYPE data is classified, or how it was given to us, is in terms of heroin, OATs, and then other opioids. So again, we can see that that's an increase and opportunity, as I say, in terms of interventions. So we know overdose is not good for people and it causes lots of consequence. But I suppose neurologically then, we know that, if somebody doesn't have the proper help in the right amount of time, and they have some lack of oxygen going to the brain, that can have a knock-on effect, and certainly a cumulative effect. But again, as I say, from a public health perspective, what we're really driving home is opportunities and interventions like naloxone, and the importance of getting those to people in real time. And the way that we do that is because of the strong workforce that we have at the moment, and community of people responding to overdose, both non-fatal and fatal. So I suppose in terms of what we know works, and a massive showcase of all of this today is post-overdose research or outreach. So people reaching the community knowing that they are at risk. Brief interventions on the frontline level, linking people then to substance use treatment, and explaining the harm reduction strategies. So again, we know that these are key, strong, evidence-based practices, and we know that we are doing them, and we're doing them well in Ireland. And then mental health supports and integrated care, again, around people who have complex needs, so people experiencing homelessness, and people who have a co-occurring mental illness then will need an additional level of care. But I suppose what I really want to hit home today is, and we see this in terms of initiatives, programs, and projects, is that peer support, and particularly recovery coaching, when we place them in places where people are presenting with overdose, so prisons, emergency departments, and police stations, we know that people are recovery coaches is something that is really bearing a lot of fruit. As always, if you look at emergency department interventions, they're a key place for intervention to happen. Again, we have great, excellent showcase of interventions, programs, and projects where we've done this. But I suppose what I'm calling for today, and indeed social support and housing assistance, is that we need to do this in a more systematic, systemic way. So investment needs to be had in terms of that good peer support, corralling all of those, ensuring that we're at the site that's of highest risk. So again, presenting in emergency departments when people are coming out to nothing, and equally then ensuring that our social and housing supports are stocked and resourced. So thank you, Dennis.
Thank you, Johanna, and thank you for probably pointing us in the way where it's the touching point and the opportunity to intervene and prevent. And thank you so much for that. On that note, I would now like to move and introduce Andy O'Hara, who's the coordinator for ISCA. And Andy today is going to introduce the What's the Story, Breaking Down Barriers and Building Stronger Communities art project. Thank you, Andy.
Thanks, Dennis. Look, as a person who has known a lot of people that have been lost through overdoses, and I've actually overdosed myself, and in one instance I was brought back by a family member from an overdose. So I know that at one point I thought I didn't really care if I lived that way, because I suppose I simply thought I was a burden and a problem, and that I had no real value and nothing to offer. And that's when people are most at risk of overdose, and that's linked to how we see, treat, and stigmatise people who use drugs. The following video is actually how we shift the narrative from people who use drugs as simply a problem to actually being part of the solution. In this project, they work with everyone who has fears or concerns about the upcoming safe injecting facility. And they really showed how we all actually want the same things, to really save lives and build stronger communities. But it's how we do it. And in fact, together we can. Another example is in November 23 alone, during the first HSE Red Alert, Airpeers actually trained and provided kits to over 180 people on the street and in services. This year they've done about 380, and we know many of those have saved lives. I'll finish with a quick poem from a peer who's been coming to ISCA for the last few months. It shows what leads to overdoses and, more importantly, how we prevent them. They insisted on staying anonymous, as their experience sometimes is when they speak up, they get punished, or that they're allowed to have a voice depending on what it is they want to say. They said they've actually spent their whole life having to try and figure out what people want to hear and how to say it, to the point where they've actually lost who they are, which resulted in overdoses. Voice in the shadows. In the silence where judgment lies, ISCA stands with clear, defiant eyes. They march for those unseen, unheard, giving power to every whispered word. In a world where stigma builds a wall, ISCA's voice becomes the call. An advocate for those who strive to find their worth, to feel alive. They fight for those who bear the weight of society's cruel and unjust fate. For every life marked by disdain, ISCA works to ease the pain. Activists for change, they burn with fire, to lift the fallen, to inspire. In the face of scorn, they hold their ground, breaking change where they are found. Each story shared, a beacon bright, in the darkest corners, they bring light. For those who've lost their way in shame, ISCA fights to clear their name. They see beyond the surface lies, to the human soul that tries and tries. With compassion as their guiding star, they lead the way, they raise the bar. ISCA's mission, clear and true, to bring respect where it is due, to give a voice, to heal, to mend, until every stigma meets its end. So let the world now hear the sound of justice rising from the ground. For ISCA stands unwavering strong, in the name of those who've suffered long. Enjoy the video, folks.
Trying to make this new, and each day there's going to be different people coming in. So some of us will sit down with the guards, some of us will sit down with people from the local community, you know what I mean, from the Department of Health, and we'll be talking around what are the issues, why we want the safe injecting facility, how we can kind of work with them to kind of create change. Be a chance for you to tell them your story and listen to them.
It's massive. It's so big that people will not believe that the change has made. And it's up to the people to come in, to help us, guide us, and both us come to the table and have ideas and share them. And especially with the people who live in the area. When you go up in an area where I did in Dominic Street, where there's heroin every day, and people injecting in front of you, they understand that, you know what I mean? And they see that day in, day out. I've seen that through my life, you know what I mean? So that same experience. So there's no change. So when we come to the table, ideas will be shared and put together and hopefully get the great understanding.
It's going to be amazing, but the community should have done years ago.
Apprehension will always come with new things. We don't know what to expect. So what we took from all the other countries that done this, the data shows that it's a change in good. So I don't see a reason why it wouldn't be a change in good here if we go by the right steps.
Being a mother myself, like, I can understand where they come from when they don't want the facility in their community. Now, I do really understand being a mother myself. But as I said, they're going to do it there anyway. They're doing it on the street now, around our community anyway. So would you not rather than be in a place out of the way so that children can come and go to school or whatever and not have to see that on the street?
I was a PIN baby, which is an intravenous drug baby. Both my parents were intravenous drug users. My father then went on to die from intravenous drug use. I was having my own history in intravenous drug use as well, and carrying the stigma and the discrimination of that. For me, I suppose it's an amazing opportunity to have my voice and my peers' voices involved in, designing of this, and I think it's paramount going forward that we are considered in all aspects of the design of the MSIF.
My job with the mural was to paint this fella here, and to me, I've not asked what he means, but to me, it just looks like a fella that's in despair. I've been like that, probably in that exact same position many a time. This new place will help a lot of people because on a daily basis they're going to be around people. So if they're going to use the service as it's there to be used, and they're going to be in front of nurses and people there, so when the day comes that they do feel like this, they can actually, the help is there.
Anybody out there who does need a help or needs a bit of help, we're here, we're Ishka. If you're a person with lived and living experience, you're integral to the change that we want to do, so hop on up.
Thank you, Andy, for that profound poetry piece, and also how it's so important to have things reframed and to have the engagement of everyone in services, and also for the video piece from the peers at Ishka. Now I'd like to introduce Stephen O'Flaherty, who's the Community Engagement Officer at the National Ambulance Services, who's sharing details of the community CPR and naloxone demonstration events being held tomorrow on International Overdose Awareness Day, and just to acknowledge the great ally that Stephen has been to this programme. Thank you.
Thank you, Dr. Driscoll. I'm delighted to talk to you today about our network of volunteer community first responders and how we are supporting the International Overdose Awareness Day with our demonstrations tomorrow. The National Ambulance Service Community Engagement Team falls under the remit of the clinical directors within the National Ambulance Service. And one of our primary roles is to improve out-of-hospital cardiac arrest survival, utilising community first responder groups, community training, and community engagement events. We have a national manager and 6 community engagement officers who are aligned to the regional health areas, and that's all supported by a team of 4 business support people as well. The naloxone program itself, there's a lot of synergies with our strategy in the ambulance service to reduce, to improve out-of-hospital cardiac arrest survival. And it was great to be able to support the naloxone program by becoming Module 2 facilitators alongside our CPR training remit. So myself, Amanda, and Jonathan and Liam have completed the training earlier this year, and we're delighted to support the naloxone program with on the module 2 facilitation. It's a great training, and we'd recommend everyone to do it who's interested in learning more about naloxone. Our community first responder groups are volunteers who are trained to attend certain types of emergencies in the area where they live and work. And we have 292 community first responder groups registered with us as of this month, and they attend over 10,000 calls annually throughout Ireland, supporting a quick response to life-threatening emergencies in their local communities. The vast majority of these are volunteers, and they are an essential link in the chain of survival. And they've also got a network of CPR instructors trained by the National Ambulance Service to deliver CPR training in the community. So we're extremely privileged to have a network of dedicated volunteer instructors who are passionate about community CPR education. And with this year's International Overdose Awareness Day theme, we felt it was an excellent opportunity for collaboration between our CFR groups, the National Ambulance Service, and the naloxone program. Together, we can support International Overdose Awareness Day by running 6 community events demonstrating CPR and how to recognize and respond to an opiate overdose. So those events are going to be held in different locations across Ireland. So just on the screen there, we've got events running in Drogheda, Dublin, Carlow, and Cork. And the times are there. Most events are kind of running across lunchtime or certainly into the afternoon. And if you're in the area, please call in, visit the demonstrations. You can learn about CPR, signs of opiate overdose, and how easy it is to provide naloxone, intranasal naloxone to those in need. So we're delighted to see you tomorrow if you're in the area. So again, thanks for your time. If you'd like any more information about joining or forming a community first responder group, you can click into becomeacfr.ie where there'll be more information available. Thank you.
Thank you, Stephen. And again, to thank Stephen and the team and the volunteers who tomorrow are running these CPR and naloxone training sessions across the country, to please send it out to Ether so he has an amazing attendance at them, because it does mark an important piece of work within the whole program. So on that note, I am going to close out today's webinar, and I'd like to thank everyone for joining the webinar today and staying with us. I appreciate we've ran slightly over. So today's webinar was extremely important to raise the awareness on overdose and its prevention. As I said, this session has been recorded, and a link to the recording will be shared in the post-event email. I want to express gratitude to all of you for joining. Together today, we have raised awareness about overdose, honoured the lives lost, and acknowledged the grief experienced by family, friends, and communities. This year's theme, Together We Can, emphasises the power of standing united as a community to combat overdose. Throughout today's webinar, we heard from experts, services, and peers, all dedicated to reducing overdose and supporting those who use drugs. We learned about the administration of naloxone in 23 and 24, the expansion of naloxone accessibility through HSC land training programs and HP area registrations. And most importantly, we heard from real life peer-to-peer overdose prevention volunteers who gave us evidence from the ground, and also their own experiences through the Circle program, through ISHCA, and through other organizations. We would like to thank Novus for sharing this initiative for the Circle program. Additionally, we are introduced to the new individual overdose rescue and safety plans, which will be shared in the chart and followed up in a follow-up email. These plans were inspired by the UK's People Using Heroin Alone Safety and Rescue Plan, and we thank John Sharrock for sharing his insights from the UK Drug-Related Death Conference, but equally to thank Dennis for his insights into ensuring that the rescue plans were suitable to the needs of the service users. I would like to give a special thanks to ISHCA and to Andy and his team for their compelling What's the Story video, which resonates deeply today with today's theme. We also discussed the causes and consequences of overdose and how recovery coaching can help individuals towards recovery with the help of experienced peers. I would like to thank the National Ambulance Service, Community Engagement Team, Jonathan, Stephen, Liam and Amanda and their manager Ger for their continued support and allies of the naloxone programme and their coordination of tomorrow's events. And to Minister Colin Burke, Minister for State and Responsibility for Public Health, Wellbeing and the National Drug Strategy. Thank you for your ongoing support and political will to overdose awareness and prevention. Finally, I'd like to thank our presenters, the HSE National Social Inclusion Office, Professor Eamon Keenan, and most importantly, Jenny Smith for all her hard work in the background for facilitating this event, and also for IMS for the facilitation and managing the event as it went on. And finally, to the community first responders who are volunteering at tomorrow's demonstrations events. Together, we're making a difference and preventing lives from being lost to overdose. And finally, I'd like to thank you all for your participation and dedication to this. Thank you so much.